Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Thyroglossal cyst. Thyroglossal cyst is actually a cystic swelling. It is a cystic swelling which is developed mainly, it is developed in the remnant of the thyroglossal tract or thyroglossal duct. So, thyroglossal cyst is a cystic swelling which is developed in the remnant of thyroglossal duct or thyroglossal tract. So, what is the sites? The common sites of the uh, Thyroglossal cyst. Thyroglossal cyst, the main common sites, if you see, the most common site of thyroglossal cyst is in the subhyoid region, is the most common site. Then this thyroglossal cyst is also present in the region of thyroid cartilage, or it can be suprahyoid, or it can be present at the floor of the mouth, or it can be present beneath the foramen cecum also. Then, now, what are the clinical features of thyroglossal cyst? A thyroglossal cyst, actually, thyroglossal cyst, it will present has a midline swelling, and the patient with thyroglossal cyst presents has a midline swelling, and this midline swelling is present, and then it is a congenital swelling. Truly it is a congenital swelling, but the age of presentation is between 15 to 30 years of age. Though it is a congenital swelling, the patient presents at 15 to 13 years of age. So if you try to move the cyst can be moved on. If this is the cyst, it can be moved on either sides but not vertically. So this cyst can be moved on sideways, but it cannot be moved vertically, but it is not moved vertically. One more important thing on palpation or on examination, if you ask the person to protrude the tongue, if you ask the person to protrude the tongue, then the uh, thyroglossal cyst will move up on protrusion of the tongue. Then if you ask the person to swallow, then the thyroglossal cyst will move down with deglutition, and this cyst is actually lined by pseudostratified, it is lined by pseudostratified columnar epithelium. This thyroglossal cyst which is there, this thyroglossal cyst is lined by pseudostratified columnar epithelium along with the squamous epithelium also. So this is present in the heterotropic rest of the tissue. Then what about the complications? Complications of thyroglossal cyst, if you see, right. In the complications, the patient will have recurrent infections because it is a cyst, it can become infected in some cases. So, recurrent infections are common in thyroglossal cyst. This thyroglossal cyst can become a fistula also. So, thus, formation of thyroglossal fistula can be seen, and sometimes a carcinoma can also develop in the thyroglossal cyst, thus resulting in papillary carcinoma of thyroid. Then, what about the treatment of thyroglossal cyst? So, for the treatment of thyroglossal cyst, we do an operation called as cyst trunk operation is done for the treatment of thyroglossal cyst. In the cyst trunk operation, there is en bloc removal of the thyroglossal cyst is present. There is removal of the thyroglossal cyst is present. Along with this cyst, you will have to excise the central part of the hyoid bone is also excised. That means, for example, sorry. Okay, if this is the hyoid bone, actually in the thyroglossal cyst, the subhyoid position is most common. If this is the cyst, along with the thyroglossal cyst, you should also excise the central portion of hyoid bone is also excised to minimize the recurrences.
thank you and thank you for watching.